Welcome to PowerMD. This is an instructional video for reconstituting a powdered medication to liquid form for injections. You'll get your medications in a dram or a box. The box will have instructions on the outside of it, or the paperwork that comes with your prescription will have both an RX number that you'll need to save for traveling, as well as your name and your dosing amount, and also a reconstitution or mixing volume. Your kits will also come with these reconstitution syringes. They're quite large, 10 milliliters or 10 cc's. Your instructions will say the amount of cc's of diluent or water or saline that needs to be mixed with your powder. When you draw up your liquids, you're going to use the top of the black syringe. So if you can see here, I've stopped at 4 cc's. 5 cc's, 6 cc's, or 7, or all the way to 10. B12, for instance, is mixed with 10 cc's. Some of our other common medications are mixed with 7 or 5 or less. When you open up your box, you'll have 2 vials. One will be a diluent or water, liquid, and the other one will be the powdered medication. They'll come with security tops. You just pop those right off. Once you have your powdered vial and your water or reconstitution diluent vial, you'll take your mixing syringe and make sure that needle is on there tightly. If you don't, it could pop off during the process. After uncapping your needle, you'll take your liquid vial and you'll draw up the amount of liquid that's prescribed. For my example here, I'm going to use 4 cc's. As you draw up, you'll see you do get some bubbles. We'll take care of those later. Draw up more water than you need. Say a cc more. If I need 4, I take 5. Or half. If I'm all the way down at the 10, I may not take a whole cc extra. What we want is just enough that we can get these bubbles out. You'll always be provided with more than you need as far as your diluent goes. As you push up and you clear most of the bubbles, I usually like to give it a little flick, make sure I've got all those bubbles out. And then I'm going to stop on the amount that I need. Once I get my 4 cc's or whatever is prescribed, I stop the stopper. The plunger will be right at the 4. If you can see there, there's the 4 line. And that's where I want to stop. You'll take this and you'll insert it to the center of your rubber stopper in your powdered vial, deplunge all of the liquid, and reconstitute your powdered medication. One thing that you can experience is a vacuum pressure in the vial. It makes it difficult sometimes to push all of the water into your vial. Rather than forcing it, I recommend backing your needle up, so taking some of that air out of the vial, and then you will be able to deplunge all of the water. So if you need to, just allow that air to come right back out, and eventually all of the liquid will go in. As you can see there, there's a positive pressure inside the vial. It's forcing some of that air to displace. But that's how I get all the water in. Once you take that out, invert your medication vial gently. Don't shake it. Just invert it. It should instantly turn to a liquid and it's ready to use. Most medications that are reconstituted in this way from a powdered form to a liquid form do need to be refrigerated. It should also be on your instructions, but if you have any questions, just call the office.